Good evening. Today is Wednesday, April 22nd. Welcome to the weekly live Facebook question and answer forum hosted by the Stanislaus County Office of Emergency Services. I'm Linda Muma with Stan OES.
And I'm Amy Vickery, Stanislaus County's Public Information Officer. We will both be moderating tonight's live event, which will be recorded and later posted to the Stan Emergency Facebook page and YouTube channel. As a reminder, send in your comments, but remember direct messages coming in during the show will not be answered, only the comments.
You won't see us on camera tonight, but you will hear our voices as we help direct your questions to our panelists.
Joining us tonight are Dr. Julie Vachampayan, who we refer to as Dr. V, Stanislaus County Sheriff Jeff Dirksey, and Chair of our Stanislaus County Board of Supervisors, Kristen Olson.
Let's begin first with Dr. V for an update on the latest number of cases of COVID-19 in our community. Dr. V, can you tell us where we stand today?
Yeah, so today we reported 251 cases, and we had one more death today to bring our deaths to 5.
Thank you, Dr. V, for that update. The next question, Supervisor Olson. We have a new public health order that was just released today. And many of our residents believe you made the call to open up softly some of the businesses in our community. Half are concerned that it wasn't a good idea. The other half don't think it's enough. Can you talk a little bit about that process and who made those decisions?
Yes, appreciate the question because there's been a lot of confusion on this topic as we've heard. So it's important to understand that every time we're having these conversations, whether it's modifying the existing order or later on when the time becomes warranted to begin slow reopenings of the economy, that those conversations and decision points always start with data. They always start with science. This is a daily, sometimes hourly activity for us at the Emergency Operations Center in very close coordination with public health and only according to the guidance and recommendations of public health. And so the new order coming out this week, which goes into effect at 5 a.m. on Friday, April 24th, this Friday, was at the recommendation of our public health officer, Dr. V, who's here with us this evening. And it had been in the works for quite some time based on the data and the science that we're evaluating daily, based on the modeling. We do have new modeling at stanemergency.com, which will probably be discussed this evening. And so based on those decisions, Dr. V and the Emergency Operations Center team, we evaluate what makes sense at this time and what doesn't make sense at this time. And that's what the order was based on. Some of the confusion is at the same time, some of the mayors in our county put out a letter talking about a slow reopening of the economy and encouraging us to be able to pursue that when the time is warranted and asking Governor Newsom to be able to delegate authority to local communities so that decisions can be made based on the data and science in particular counties. And so it was just the coincidence of the timing that that letter went out at the same time as the modification of the order. They really have nothing to do with one another. This order had been in the works for quite some time and was at Dr. V's recommendation based on the data and science and what's warranted in our community at this time.
And since you brought up science, I'm going to turn to Dr. V to talk a little bit about the science that went into some of this decision making.
Yeah, thank you. So we looked at many different things, and as you know, this is a balancing act. We really need to balance how we respond, how we look at our activities, ensure our hospitals are good, ensure we can do contact investigations, and there's many things that go into these decisions. So as we start looking at our hospitals are not full, as you can see on our modeling on the bar graphs on the second page. So what we were looking at is the amount of people hospitalized and the amount of Stanislaus County residents who are hospitalized. We have, there are also non-county residents that are in the hospital in our county. And looking at that, it has decreased over the past week or so. In addition, we look at our case counts, and our case counts have been up. Primarily up because we're doing really good contact investigations, and most of these are being found off of contacts. I don't want to give people the impression that COVID-19 isn't spreading in our community. It is, but we are finding many through our contact investigation, taking quick steps to isolate people who are ill, quarantine those who are exposed, and stop the spread in our county. So we've been working very hard at that. So another thing we look at is our ability to do contact contact investigations quickly, and our ability to test and find out who's infected quickly. And both of those have been improving over the past few weeks. And then I guess the final thing really looking at is the weather. So the virus, we know, does not live outside well as it gets hotter. So the warmer it is outside, the less the virus will live on surfaces. So as we look at the weather forecast for the next 10 days, it's all in the 80s and 90s, which gives us great comfort to start increasing the amount of outside activities that are available for us to do. So that was kind of the science and the data that we looked at to open up the activities a bit more as we move forward in Stanislaus County.
Thank you, Dr. V. You're referencing our surge modeling graph that went up online on stanemergency.com yesterday. Can you tell us a little bit more about that for people who haven't seen it? What exactly does the graph show? And when do you think we're expected to hit our surge or peak?
Yeah, so we have many models, as you can see on there, we're looking at. So if you look at the graph, there are 4 basic models that are shown there that show different things. And these are planning tools. It's really hard to predict the future. It's very hard to predict the future when you're dealing with a virus that no one has seen before and we don't know how it acts. So these are planning tools, and I want to say that. You know, I keep saying all models are wrong and some are useful, and so we're trying to use these as we look at how to plan the number of beds needed and many things. It is not going to be very accurate trying to look at when the peak is. We all want to know that. I want to know when the peak is or was. If we're past it, I don't know. That's something you can only tell after it's passed, right? You have to be well on the downhill slope to know that you've hit the peak. So these models are showing us, trying to show us the future. And as we continue to add more data, the data that we put into the model changes because we have more information on what has happened. The people who have made these models are perfecting these models a little bit more. So we're using them, we're watching them, and then that's basically their best use.
Thank you, Dr. V. This next question is for Sheriff Dirksey. This comes in from Zach on our Facebook feed. Zach wants to know, while gradually reopening businesses, how will law enforcement make sure that businesses are following the orders and stay compliant for the safety of everyone?
Yeah, so a few things I want to kind of address around that. First, I want it to be very clear to everyone that this order goes into effect on Friday at 5 in the morning. And that's done intentionally because we want to give you, the public, an opportunity to plan. Whether you're a community member or a business that could possibly reopen, we want to give the opportunity to plan for that. So with that, I'm going to ask everyone, do not open early. I'm specifically talking to those businesses that might be able to come, reopen. Don't open early. It's Friday at 5 in the morning. So know that going into it. As we have in the past, any of the businesses that are not in compliance, we ask you to email us. We're going to post an email address on this Facebook and email us. Identify the business. We will reach out to them. All of our businesses have been very good. They've been very compliant across the board, and we really appreciate that. It just takes an element of education. So with this, there are going to be some new guidelines around either social distancing, maybe if they need to wear a mask, whatever the case may be. Just send us that. We will reach out to them, do some education, and I'm confident that our local businesses will absolutely comply. And I would also like to kind of add there that if you're uncomfortable with a business, you have every right not to go to that business. If you don't think that they're doing the right thing, don't go there. Let us know and we'll talk to them.
So viewers are really, really eager for their hair salons and nail salons to open. So what to people who are thinking, maybe next week their nail salon could open or their hair salon can open? What if they do just sort of decide to open? What happens then?
It'd be the same thing. shoot us the email and we will contact them. So let's be very clear that under our order, or this new order that we have issued locally, this in no way is in contradiction to the state's order. All right, this just provides some more clarity around locally what we can or can't do. So hair salons, nail salons are specifically prohibited from opening under the state's order, and they cannot open. And again, if they go down that road, then we're going to reach out to them and take the appropriate steps. So send us that information. Now, obviously, there's a major financial impact here for a lot of our local businesses, hair and nail salons being the topic at the moment. What I would say is that potentially under phase 1 or phase 2, as the state starts to lift their restrictions, we would expect that those type of businesses could open under those new or lower restrictions. And no, I don't have a time for that, or a date.
Thank you, Sheriff. This next question is for Supervisor Olson. Just to clarify things, because we have this new next steps coming out on Friday. Can you just clarify for folks what all will be done on Friday and what will be done possibly in the future?
Sure. And it's important to clarify tonight, too, what we're calling this stage that we're in. We don't want to cause confusion. There's been a lot of different terminology used at the state level, the federal level, and the local level. We had been calling this new order that goes into effect on Friday, as the sheriff described, phase 0. We're actually modifying that terminology because it's a little bit confusing based on what's happening at the federal and state level. So we're just calling it the immediate stage that we're in. So this immediate stage that we're in, Dr. V has modified her current stay-at-home order in order to allow some activities that are consistent with the statewide order as well as with the local order. We are not modifying it in any way that isn't consistent with Gavin Newsom's statewide order or with our local stay-at-home orders. And so the modifications include 3 primary things. One is outdoor activities. So golf is included in outdoor activities. Parks, we expect parks to reopen, including playground equipment. You know, we are asking parents to make sure that whether you're at a park or a basketball court, a tennis court, etc., you are only engaging in those activities with members of your own household. And so these types of outdoor activities will be open for people to participate in, again, with members of their own household in order to encourage ways that people can recreate and get outside. The second one is drive-through or drive-in churches. We've had some churches request this over the last few weeks, and Governor Newsom made it clear late last week. He was clarifying his order that those types of activities will be allowed. So we've written that into our local order as well to allow churches, based on their own discretion, to allow drive-in churches, which simply means driving to a church parking lot. You know, they'd be responsible for the logistics, but people remaining in their cars and participating in some type of faith-based service. And then the last piece that's in this new modified order in this immediate phase, while both the state and local stay-at-home orders are in place, is automated car washes. And this is really, again, like everything else, based on the data and the science and actual data that's happening in our community at this time, and on the realization that an automated car wash, you actually interact with fewer people than you would at, say, a fast food drive-through, where you're interacting with the cashier. In an automated car wash, you literally aren't interacting with anybody outside of your own personal vehicle. So those are the 3 areas: outdoor activities, drive-in churches, and automated car washes that will be allowed under the modified order that goes into effect this Friday at 5 a.m. And getting back to the question earlier about the confusion that this may have caused on Facebook or in other social media venues, we really believe in the importance of transparency and providing advance notice to our community so they know what to expect. We've been getting so many questions about what to expect. And so it was out of an interest of transparency and notice to the public that we as a team decided to preview some of that on social media before it goes into effect on Friday so that we can answer people's questions in venues like this evening.
Thank you, Supervisor Olson. We'll stay with you for just a second because there was a question that came in from Facebook, and you may have just touched on it, but you may want to elaborate a little bit. The governor today said he wasn't relaxing the stay-at-home order. So how is Stanislaus able to do so if Newsom said no?
Yes, it is important to understand, as I think most people do, that we don't have the opportunity to begin reopening our economies until Governor Newsom lifts his statewide order and delegates that authority to local public health officers to make that decision based on their own communities or their own regions when they feel that the data and the science warrants various reopenings of different sectors. And so the modifications that are going into effect on Friday are consistent with Governor Newsom's statewide order. There are many other counties across the state that have already been allowing these activities. So we are just making modifications to the current stay-at-home order based on the data and science that Dr. V, in her medical expertise, feels is warranted in our community at this time. But again, they are consistent with the statewide order that remains in effect until Governor Gavin Newsom announces that he's lifting that and giving counties and regions the opportunity to make those decisions on their own.
Thank you, Kristen. This next question is for Dr. V. This comes in from Facebook over the course of the last week. Are you concerned about opening businesses too soon and seeing potentially a spike in positive cases or perhaps deaths?
So yes, I am concerned about that, which is why I think it's so important to have a stepwise, phased, whatever word we want to use for it, approach. We are developing plans with all sorts of sectors about how this can be done in the safest manner possible. So it will be slow because we need to make sure that it's going to work and not increase cases and spread. I think the worst possible thing that could happen is we go too fast and then we have to go back and ramp it back down. I think that would just hurt us all tremendously. So I think the best thing to do is to just start slow, get good plans in place, and have everything ready for when the time is right. So this is what we're working on right now is how we can reopen safely in the coming weeks and still be able to protect people, keep our hospital system up, and make sure that we're doing everything we can to protect everyone and walk that balance that I keep talking about, try to keep on the right place in the balance.
Thank you, Dr. V. One big important step that we made this week was opening our Project Baseline Verily drive-through testing site. So we have a series of questions for you. This will be sort of the rapid fire segment on the drive-through testing site. Can you tell us quickly, how does it work and is it working well?
So it's working great, actually. So how it works is there is a website that the person can go on and they answer a series of questions. So you have to be a Stanislaus County resident and you need to have symptoms and you need to have an underlying disease or something that puts you at risk for severe disease. And these were built in the platform. They're the same criteria that's used statewide for all the Verily testing. They are not customized by county. So this is a consistent testing process. And then if you're approved, then you get an appointment time and you drive through. And I heard today that it was timed and it took 3 minutes from start to finish from the time you arrived and moved way through and had your nasopharyngeal swab taken and left. So it's working very well.
Great, thank you. How many people are being tested each day?
So we have slots up to 200 right now. And so we started slower. So we had 50 the first day on Monday and then slots for 100 yesterday. But right now it is at 200 per day. And we will see if that fills up and if they come.
Dr. V, I'm going to stick with you for just a moment because we still have quite a few questions about testing. That's been a hot topic this week. Do we now have enough testing supplies to test everyone pre-screened online who are eligible?
Through the Verily, right now we have enough supplies. Test swabs are still very difficult to come by. So for now we do. If we start to get short, we will decrease the number of time slots that we have for testing.
And as a result of this new testing site coming online, should we expect to see a spike in positive cases in our community?
Yeah, that's a hard one to answer. It's predicting the future again. So we may see more increased positives with testing because we know we're not getting all the people who have this disease. They're not all getting tested. So we know that. What we really follow more than that is hospitalizations, because that's a pretty consistent measure that's not going to depend on how much our testing is out in the community. And that's what we're really following as we look to do this new order. And so hospitalizations is really what we're following. So yeah, we might find more, and that's a good thing, because then we can put the isolation in place. Anyone who's sick should be staying home anyway, but then we'll do the contact investigation and be able to stop spread through the actions that we're able to take.
Thank you. So Peter and Janice Williams, again on testing, want to know what are the guideline factors that allow someone to get approved for testing?
Yeah, I thought I went through that pretty much. You have to be a Stanislaus County resident, you have to have an underlying risk factor, and you have to have symptoms. And the symptoms are fever, cough, shortness of breath, our usual respiratory symptoms.
And Dr. V, one more question about testing. This comes from Nancy Gomez. Nancy wants to know, will Verily report the positive and negative cases to the county, and will those be incorporated in the daily totals?
Yes, so the testing is done by Quest. So yes, positives are required to be reported to us by law, and they are. Negative tests, as I've said before, are not required to be reported, but most labs, many labs, are reporting them. And Quest is one of those labs, so we should have all the positives and negatives. But not all labs are reporting the negatives, and so we know our negative count is an undercount, but it's still something that we can collect and measure.
And we've seen a lot of negatives, so that's a good thing. Thank you, Dr. V. Next question is for the sheriff. So another recent piece of news probably most of us have read about was the inmate released to Mendocino County. Can you talk a little bit about that and how we're ensuring that those we've released are quarantining before they re-enter public if they've tested positive?
Yeah, so many of you may have read in the newspaper, seen on TV, that an inmate was released and ended up in Mendocino County. Now, let's start with being very clear. We did not release them from the Stanislaus County Jail. That was a prison inmate from the state prison system. That particular individual was in a prison in Chino and was released was exposed to COVID-19 on April 7th. The prisons released him from the Chino facility on April 8th and gave him a bus ticket, allegedly to return to Stanislaus County, which is where he was originally from. That individual took the bus across half the state to Mendocino County and contacted us on April 9th, which is also when we were notified by CDC, the state prison system, that he had been exposed on April 7th. Interestingly enough, the prisons wanted us to quarantine that individual for 14 days, which I found a little bit ironic since he was quarantined in prison. However, kind of specifically to the question, we did not release him. The state prisons released him. Once we found out that he was in Mendocino County, our probation department that he was supposed to report to, they reached out directly to Mendocino County and spoke with them. I actually exchanged emails and a phone call with the Mendocino County Sheriff regarding this individual and advised him of what had happened. And they certainly understood it was not our release. So, and then kind of to the second part of the question on what do we do? Well, we do not test everyone that we are forced to release from our jail. However, everyone going into the jail is screened. Medically, if they have any symptoms, they go into a separate unit. Everyone that's booked goes into a unit where they are held together for 14 days just to prevent the spread or eliminate the spread inside of our facilities. If someone does have the appropriate symptoms, then they are tested. We have tested 5 of our inmates for COVID-19. None of them have tested positive. So at this time, we know of no known cases inside of our jail facilities. So when someone is released, we have no reason to believe that they have COVID-19.
Thank you, Sheriff. We've got a series of questions for Supervisor Olson. A lot of people are asking about the new measures that are going to be going into effect Friday morning. Can you again just clarify which businesses will in fact be opening, specifically when it comes to car washes? Because we're getting a lot of questions about automated versus other types of car washes.
Sure. So happy to clarify again the modifications made to the existing order, the stay-at-home order that will take place on Friday. So specific to the car washes, the ones that will be allowed to be open are automated car washes where employees are not the ones washing or drying or waxing or detailing a vehicle. Those types of services and businesses are still not allowed to take place under the stay-at-home order, either locally or statewide. So the types of car washes that will be opening are like Mr. Car Wash that is in many places across Stanislaus County. That's just one example where it truly is an automated car wash. You remain in your vehicle throughout the experience and throughout your car being washed by machinery. Those vacuums are allowed to be open as well because they're self-operated. What is not allowed are car washes where employees are working on an individual's vehicle. That is still not an allowed business under the modified order. And then the other two, just to repeat, that are opening up in Friday's order are outdoor activities as well as drive-in churches. And again, the drive-in churches is just to clarify what the governor already clarified last week and at the request of some churches across the county.
I'm going to stay with you for a moment, Supervisor Olson, because a lot of comments and questions are coming in recently about Project Room Key, and we haven't really talked much about that. So Angela Kahn sent in a question recently, and she's saying, what, if anything, is being done to help the homeless get off the streets into motels or hotels per the governor's new program? What's happening here in Stanislaus County?
Yeah, so this is an enormous challenge, and it's not a new challenge, right? This is something we in Stanislaus County and every county across California has been struggling with for a few years now. It has heightened in people's awareness during this COVID-19 pandemic, but it is not a new challenge. So Project Room Key, as it is taking place in Stanislaus County, is specifically for the purpose of allowing for more social distancing within our existing homeless shelters. And so many people have read about the Modesto Hotel opening this week, and the people who will be moved into the Modesto Hotel are those people who are either over age 65 or who are health compromised, have underlying health conditions, who are living in existing shelters, whether that's the Gospel Mission, Salvation Army, Host House, a number of different existing shelters across the county. Again, if they're over age 65 or immunocompromised, they have the opportunity to move over to the Modesto Hotel where they can have more social distancing between themselves so their own health is better protected, and where by doing that, we can also allow for more social distancing within the existing shelters. So that's how we're addressing Project Room Key at this point across Stanislaus County.
Thank you for explaining that. Jeanette Solomon would like to know if the homeless that will be using the hotel are going to be required to be free of substance abuse.
Yes, no substance abuse or drug behavior is allowed at the Modesto Hotel. There are actually very strict parameters. Visitors are not allowed at the Modesto Hotel. Smoking within the rooms is prohibited. They will have the ability to get outside for exercise, 2 or 3 times a day, and they could smoke there. But no, it is a drug-free zone, and there will be very strict parameters at that location.
Thank you, Supervisor Olson. This next question is for Sheriff Dirksey. We're getting a lot of questions right now on Facebook regarding camping and also regarding fishing as well as our parks. When can you expect for these things to open?
Yeah, so our local parks will be open, our community parks on Friday, beginning at 5 in the morning. And this is countywide, and this will be in the cities as well. Now, one thing I do want to point out is I would ask many members of the public, have some patience with some of the cities. Obviously, they have to reopen all of the parks that they have closed, and that may take some time. So they are well aware of this. They are actively working on reopening their parks. Just realize that at 5 o'clock in the morning on Friday, they may not be fully there yet. When it comes to activities like fishing specifically, there are many access points where you can still fish, specifically on our rivers. Fox Grove, I know, is open, and you can get on the Tuolumne River there. We are also going to be posting some information on where you can fish right now. Just to help, this question has come up, I think, every week, and it'll help out a lot of folks as to where they can go in the short term. But if you can get on the river at one of the access points, you can fish, you can boat, you can kayak, whatever the case may be, feel free to have at it. The order does allow us to also open our regional parks, specifically Woodward Reservoir and Modesto Reservoir. What I will tell you, just to be upfront, is that's still going to take time, and I'll just probably 2 to 3 weeks is what I would target before the reservoirs themselves open. They can open under our local order, also under the state order. That is something that is very well within our authority to do so, and we will get there. But we have also reassigned staff, specifically say at the Sheriff's Department. Our reservoir staff has been reassigned to patrol to protect our communities from any theft-related stuff, robbery, burglary, whatever the case may be. So as we move forward with this, we have to reassign that staff back to the reservoirs. And we have to do that while we can also make sure that we have plenty of deputies out on the streets to, again, continue to protect our community. Also, our park staff, they have to go through the process of reopening the parks. So what we expect in the next 2 to 3 weeks is kind of a phased reopening of the lakes themselves, so that everyone can get back out on the water if that's what they choose to do. Now, with that, just know that we are still under the stay-at-home order, and that applies to household units. So the guidance that we would expect as of now is that if you're going to go out and go boating when they do open, it'll have to be done in a household unit.
Thank you, Sheriff. Speaking of great places to go and fun things to do, Jesse Adams wants to know, when will DMV open?
I don't know. You're going to have to ask DMV that question. It's come up a lot. I know folks need new driver's license, vehicle registration, and so on, but I can't answer that. DMV is going to have to answer that one.
Thank you. Going back to the parks and to Dr. V, since the sheriff just brought up parks, a timeline for parks to reopen potentially. This question is coming from Facebook, and it's in regards to Friday's measures. How can we open the playgrounds and allow children to use the equipment if the virus can live on the surface for days?
Yeah, so the playground equipment is there are children that can use it. So one of the things that makes me feel a lot better about that is the temperature again. We know that respiratory viruses and this one live very short periods of time on surfaces when the temperatures get high. So if it's 80 or 90 outside, I'm actually not concerned about virus from the surfaces. I'm more concerned about children from different households mixing. So in the order, it does say to not mix children from different households on the same equipment at the same time. I mean, I think swings would be okay. Assuming they still have swings in parks, but something like a merry-go-round, if they still have those, kids can come into very close contact, and so that's what should really still be avoided. All of the park use, we want people to go outside. It's really good for you, both mental and physical health, but you still have to keep that 6-foot social distance. We're not saying go crowd in a park. We're saying use the parks, maintaining your 6-foot social distance, and that includes kids on playground equipment as well.
Dr. V, I have another question for you. A lot of us are seeing people with masks and face coverings out and about in the community, and a lot of counties actually are now ordering the public use of face coverings when out. Is that something in the works for Stanislaus County?
Yeah, so I've looked at a lot of the science and data behind face coverings. So first, face masks, which are the ones used in hospitals. So we specifically don't want the general public using those. We need those reserved for healthcare facilities. So what we really want to talk about is face coverings, which is a cloth. And the data, there's some emerging, but it's not real strong. We think it makes a lot of sense to put a face covering on. Not sure how much it will really protect others, but it should offer some protection. So if you remember, I've talked about this a few times before, that you're wearing that face face covering in case you are infected and have either asymptomatic, very mildly symptomatic disease, so you haven't recognized it, so that you're not spreading it to others. It's really not to protect you from other people. That's not the purpose of it. So it's a really good thing to do to protect others and to stop the spread. I strongly recommend everyone doing it. I don't think it's a thing I would like to order. I certainly don't want it enforced. I don't want the sheriff going out and ticketing people or approaching people who don't have a face covering on. I think everyone should be doing it. I just don't think it's something that I am ready to order.
Thank you, Dr. V. I've got a couple of questions coming in from Facebook for the sheriff. A lot of people have brought up some statements that were made a few weeks ago, and one person pointed out that the sheriff's department stated in mid-March that we were to be closed until Memorial Day weekend. Is that still going to be the case?
Yeah, so I never said that we would be closed through Memorial Day weekend. What I said is that Memorial Day weekend was our planning horizon. So early on, we believed that this would last longer than I think a lot of folks originally did. I think there was originally a perception that if we went into this stay-at-home order for 14 days, after that we would come out of this and it would all be done. Obviously, that is not did not come to pass. That did not happen. Early on, we realized that, and so we had kind of set Memorial Day as our planning horizon. And I think obviously we're going to be pretty close to that. I do believe that we could very soon see some changes, potentially even from the state level, that will lift some of the restrictions. But as of now, we are still planning through Memorial Day that we will be under some form of this stay-at-home order for sure. I would also like to simply say we are planning to be dealing with COVID-19 for a long time. I think that if you look at any of our federal or state leaders, you can definitely get the sense that this is going to be around for a long time. Again, that does not mean that we will be dealing with this stay-at-home order or something like that, but there's obviously going to be long-term lasting financial impacts for people, for businesses. When this does start to open, it's not just going to go to a complete wide open the way it was. We're going to, the restrictions will be kind of released or lessened in stages. So as we are now with the stay-at-home order with no gatherings outside of a household unit, maybe it'll go to 10, it'll go to 25 to 50 and so on, because the key thing is we don't want to see the spread of this. That's why we always ask everyone, do what we're asking you to do. Go with those recommendations that are out there and follow them. And you know, I'll reiterate again, everyone has the ability to make some of these decisions for themselves. If you're not comfortable with a business, if you're not comfortable going out without a face mask, you shouldn't. Put that on. Make some of these decisions for yourself.
I'm going to stick with you for just a moment because Tim Close, this is in regards to the stay-at-home order. Tim Close wants to know, can the county override the state and not comply with the stay-at-home order?
No, we cannot. And I think we've talked about that. We obviously feel that the direction that we're going is both appropriate and in accordance with the state's order and appropriate for our situation here in Stanislaus County. Dr. V has talked about the modeling, the data that she uses to analyze this. Supervisor Olson has kind of talked about how we make our decisions based on that. So we're very comfortable with where we're at right now and making some of the decisions that we've made.
Thank you, Sheriff. Next question is for Supervisor Olson. Sheriff just referenced this. You talked about this a few minutes ago as one of the measures of our opening business being the governor's order. So Kevin Jones wants to know, when are you going to start putting pressure on the governor?
It's a question we're getting quite often, and I will say many of us do believe that it is appropriate at this time for the governor to lift his statewide order and delegate that authority and responsibility to county public health officers and county authorities. Now, what that doesn't mean, and we believe that because as more data and science has been collected across the state and as more studies have been done, it's showing there is a wide variance of the impact of COVID-19 in various counties across the state. There are some counties who literally don't have a single positive case. There are other counties who have extreme cases and severity of the disease. So many of us do think it's appropriate, and the time is now for the governor to consider lifting that statewide order and defer and delegate that authority back to local counties. What's important to understand is once he does that, that does not mean life returns back to normal for those of us in Stanislaus County or any other county. All that means is then he is deferring to our public health experts, our authorities, to make the decisions based on data and science of when it makes sense to begin a slow reopening of the economy. Probably one or two sectors at a time, or a few things at a time, that we can still practice social distancing, we can make sure that we're not going to have sudden extreme spikes. Again, we will make responsible decisions based on data and science, but because there is so much variance from one county or one region to another, many of us do think it makes sense to delegate that decision making back to local public health officers. And so we have begun communicating that to the state. We will continue to communicate that to the state. There are many counties, many communities who are doing the same. But again, I just want to underscore, we can't expect life to return back completely normal until a vaccine is developed and readily disseminated. And so that means over the next 12 to 18 months, there will be different aspects of the economy and our local business community that are reopening, and we look forward to that. We understand a lot of people are suffering without jobs right now, but it will be a slow reopening, a steady reopening that maintains the importance of public health as we do that.
Krista, I'm going to stay with you for just a moment. Since you mentioned the businesses that really are hurting, the county is approving several small businesses for relief grants. Can you talk a little bit about that? I know you talked about that within the last couple of weeks, but can you talk about that again? And whether another round could become available if the stay-at-home order stays in place?
Yes. So 2 weeks ago, we did open up a program at the county level for small business microgrants. These grants are for businesses of 50 or fewer employees, with an emphasis on small businesses with fewer than 25 employees, because that's over 90% of the small businesses in Stanislaus County. And so for an 8-day window, we were receiving applications for microgrants of up to $10,000, with the goal being able to provide this small financial assistance to bridge the immediate need to when they could receive larger state and federal assistance. That application window closed yesterday. We received over 550 applications. The need in our community is tremendous, as we know, and so we're going through the scoring process now to identify who's eligible, who meets the criteria, and then to be able to assist as many of those small businesses as possible. We are hopeful that over time we'll be able to identify additional sources of funding so that more of those applicants can be awarded those funds. We're so thankful for our philanthropic community, for many of the leaders in our business community who have been able to come alongside of us and contribute to that effort. And then another opportunity that is still open is the City of Modesto has a similar program. There are some differences, but it's similar, and their application window is still open. So for small businesses who do not have an opportunity to apply for the county program, they can apply for the City of Modesto program, and they can do so by going to www.modestogov.com/SBAP, Small Business Application Program. So we encourage people to do that, and we will continue to look for opportunities to come alongside of our small business community. I think one of the things we're learning in this crisis, many of us already knew it, but I hope we're highlighting the importance of a thriving, vibrant business community in order to have healthy communities.
Thank you, Kristen. I'm going to stay with you because the next question also pertains to what you were just talking about. Zach asks, how will the small business micro grant applicants be notified when they are approved or denied? And his next question has to do with the CARES stimulus money that we recently received. And he wants to know, will our county share with the community which programs will benefit from the $90 million?
Sure. So on the first question, applicants will be notified if they've been awarded the microgrant or denied the microgrant through email, through the same portal system that they applied. We expect those emails to begin to go out as early as this Friday. Our goal is to be able to come alongside and assist as quickly as possible. So staff are feverishly working to finish scoring those applications, and we do expect to begin notifying applicants as early as Friday through email on whether they are going to be receiving one of the microgrants or whether they have been either denied or waiting for additional funding sources to open up. As it relates to the CARES program and the $90+ million that the county is receiving in order to address COVID-19 impacts, yes, we will be very transparent with how that money is used. We have a history, actually, of Stanislaus County of being very fiscally responsible and transparent with our expenditures. And so there's very detailed record keeping going on right now about our expenses related to COVID-19 and how all of the monies, including part of the CARES funding and that $90 million, will be spent in order to protect and assist our community.
Thank you, Kristen. This next question is for Dr. V. We're getting actually quite a few questions about antibody testing in our community. Will this be made available in Stanislaus County?
So antibody testing is not usually a test offered through public health. It's a test offered through hospital and commercial laboratories. So it's kind of up to them when they bring the test here. But there's a couple things people really need to understand about the antibody or serologic testing. One is you don't use it for acute disease. It is not a reliable test if you're ill. It takes a couple weeks to make antibody, and so it's not a test we use when you're acutely sick. So what it's often used for is later on for immunity, but the problem right now is tests don't perform well when not a lot of people have a positive test. They just don't, tests just don't work that well. So it's not a real reliable test, and there's many unreliable tests out there. But in general, it's not going to be a very reliable test to use to make decisions on how you're going to act. So if it gives you a positive test, I can't actually say if you're immune or if that's a false positive. So I would hate for anybody to get this test and make decisions based on that result. So the time just for me isn't yet to use the antibody test. There's a whole bunch of studies and everybody talks about it. We're just not at a place where it's going to be a real useful test for widespread community use.
Thank you, Dr. V. We've talked a lot about COVID-19 and health impacts on our community. I want to ask what other new or out-of-the-ordinary health issues has your team noticed since this began?
Yeah, there's been some serious reports lately, calls up from poison control centers that are quite concerning. So with this increased emphasis, everybody's trying to clean and clean and clean, and sadly, children and pets are getting poisoned with the cleaning supplies. So I'd like to really remind everyone to clean, yes, please, and clean frequently and often, but you need to take good care of those cleaning supplies and continue to remember that they got to stay out of the reach of children and pets.
Thank you, Dr. V. This is an interesting question for the sheriff. Vivian Smith is writing that 4-H and FFA kids are gearing up for the fair in July with some uncertainty. And so Vivian wants to know if we have any sort of indication on whether it's going to happen.
Yeah, the short answer is no, we don't have a definitive answer from the Fair Board yet as to what their intentions are. But I would expect that to come out soon. Obviously, my kids did 4-H as well, showed at the fair, so I'm very familiar with everything that goes into that, and obviously specifically with livestock or any of the projects. A lot of work goes into that well in advance. So they are certainly aware of that, but we do not yet have a definitive answer from the fair.
Sheriff, this question came in yesterday from a constituent via email, actually, and he says, it costs a lot of money to fly the helicopter. Can drones be used to prevent illegal activity instead?
Yeah, so, and I've heard comments on that as well. The helicopter has been up a lot more, and that is a factual statement. We have reassigned our air unit to fly 7 days a week right now. They do a number of things, both patrol-based to prevent any sort of theft or looting. We do extra patrols with the helicopter, specifically to keep the community safe. They're also doing a number of things specifically related to COVID-19. They're evaluating homeless camps, potentially moving supplies, doing a number of things. So the helicopter has been up a lot. And it's expensive, but we are committed to keeping the community safe, and we'll do whatever we can do to do just that. Drones, we do have drones. We have several of them. They are an excellent tool, but they do not have the capabilities of our computer. A lot of folks are used to kind of this idea of a big drone, much like the military might have. We do not have anything like that. Ours are much more similar to, say, a hobby-type drone that someone might fly, and they simply don't have the endurance to fly like the helicopter does.
Thank you, Sheriff. This next question is for Supervisor Olson. This comes in from Casey Zia. It looks to be a question about essential versus non-essential businesses. And Casey is saying if currently closed businesses can follow social distancing standards, she's asking why can't they reopen so that we can balance the needs of people who need to be back to work and feed their families. Can you explain the difference between the two? Again, I think there's still some confusion.
Yes, we can. And we understand the confusion and the frustration, right? A lot of this doesn't make a lot of sense to a lot of people about why certain businesses are deemed essential and can remain open and others are not and can't remain open if you could practice the same type of social distancing in both. And we hear those frustrations, we understand them, and yet at the local level we cannot violate the statewide stay-at-home order that Governor Gavin Newsom issued. In that statewide order, there are businesses that are deemed essential and there are businesses that are not deemed essential, similar to the federal list of essential businesses. So our local stay-at-home order cannot violate that statewide order. We cannot be out of compliance with what is listed as an essential or, even more importantly, a non-essential business. And so what we are trying to do is provide guidance through our business services branch to businesses on whether they are allowed to remain open in some way as an essential business. And we look forward to when that statewide stay-at-home order is lifted so that at a local level we can make decisions based on the data and science of COVID-19 in our community at the time, as well as what can be safely reopened where people, employees, or customers can appropriately practice social distancing. This planning is underway. We have a number of business leaders, nonprofit leaders, various industry leaders currently working on writing plans for what safe openings within their industry could look like. We want to make sure that we're putting those in front of our public health experts for review so that those plans can be finalized in various sectors, whether it's the restaurant industry, retail, hair salons. We get a lot of questions about dog groomers. We want to make sure we're prepared for how to safely reopen those different industries when the time makes sense to do so. But the first step toward that is Governor Newsom lifting his statewide order. Until he does that, Dr. V doesn't have the ability to modify her orders here locally in Stanislaus County in order to allow non-essential businesses to open. But again, we want to have those plans ready to go so that when he does make that decision, she has the ability to act immediately when she thinks the data and the science warrants a particular industry reopening.
That makes sense. Thank you for that. There's a question here related to what you were just talking about. Bonnie wants to know, what about exterior painting and paint stores? Can you address that, please?
Yes, a lot of questions over the last few weeks about very detailed types of businesses, for example, painting. Our understanding, our interpretation is that is deemed an essential service. It falls under construction, which Governor Newsom did specifically call out as an essential service. So we believe painting is an extension of the construction industry and therefore is allowed to remain open in Stanislaus County.
Thank you so much, Kristen. This next question is for Dr. V. This comes in from Richard. Richard wants to know, are hospitalizations dropping?
Yeah, so we have been watching the hospitalizations, and they are in fact down over the last week or so, maybe two. So we do monitor our hospitalizations. If you look at they're posted on our website. Where our model is posted too, and you can see how full or empty our hospitals are right now, running at about 40% capacity. So they have decreased. Last week's it was higher, so we are watching that.
Just a follow-up question. Should hospitalizations go up again, are hospitals prepared for that?
So they're prepared for some increase because they clearly have capacity. The thing that we worry about the most is the PPE, of course. We really need to get that an improved supply and a regular supply in place before we see more hospitalizations, or a significant increase in hospitalizations, I should say. So the hospitals, I think, are ready. We're just waiting for some supplies that would help that. But yes, there is room right now.
Dr. V, another question for you. There's so much speculation on social media about how this is really no different than the seasonal flu. And so we dropped one of those questions in because we thought it'd be fitting to address it tonight. Brian wants to know, how do the number of COVID-19 cases compare to seasonal flu cases?
So, a lot of people make a comparison to seasonal flu, and there's a lot of things I think that help understand respiratory viruses and transmission, because it's the same. Seasonal flu is a respiratory virus, and so is this virus that causes COVID-19. So the coughing and sneezing, being close to a person is a risk for transmission face to face. But there are some big differences also. And one of the biggest difference is that we have been having seasonal flu for hundreds of years. It's been around a long time. And this new coronavirus is a new virus that our bodies haven't seen before, so we have no immunity to them. It's like a pandemic influenza. So when we have a pandemic influenza, that's a new influenza virus that we haven't seen before and have no immunity to. So there are ways they're the same, ways they're different. We have treatment for influenza. We do not for this new coronavirus yet. A lot of studies in place, but no known treatment or prevention yet. Prevention can be for pills, the antiviral pills that we have for flu. We don't have those for this virus. And vaccine. We're pretty good at making flu vaccines. We know how to make them quite quickly. We do not know that yet for this coronavirus. It'll be a brand new vaccine. So the really biggest difference, I think, between flu and this coronavirus is just simply that the entire population is susceptible. And that's what we fear so much, because if too many people get infected at one time, it is going to overwhelm our hospitals. Each year in seasonal flu, our hospitals go right up to surge capacity. They get very busy. And so if we need to keep the level of infections about the same or less as seasonal flu, we think this is a little worse, a little bit more hospitalizations, a little bit more fatality, but it's not quite sure because there's so much asymptomatic infection. We're still learning what it really looks like. But really just the takeaway message to this is, since everybody is susceptible for it, it makes it very dangerous for us.
Thank you, Dr. V. We're getting a couple of questions for the sheriff. It appears to be in regards to travel. Both Anne and Hope are asking about citations for non-essential travel. Is this really happening?
Nope, has not happened since the original state stay-at-home order. Hasn't happened under our local orders, and it's not going to happen now. You can still be out. There are many reasons to go out. Whether it's for essential services, for essential supplies, for exercise, whatever the case may be, so no. And no one is getting cited or ticketed for being out in the public.
Thank you, Sheriff. Supervisor Olson, Governor Newsom announced this week a new volunteer initiative and website, californiavolunteers.ca.gov, that aims to connect people looking to give back to their communities with opportunities in their area. What is the need like in our community, and how can people volunteer?
There are tremendous needs in our community, and it's one of the things I've always been proud to call Stanislaus County home for, is that the volunteerism here, the level of volunteerism during regular life, much less times of crisis, is truly unmatched. We've had a similar website through loveourneighbors.org throughout this whole crisis so far. And so similar to the website that Governor Newsom and the program that he announced yesterday for volunteers across California, we already have here in our community, again, through loveourneighbors.org. So if people want to get involved by delivering meals, delivering groceries, making face coverings and donating those supplies, there's so many different ways we can come along and assist our neighbors in this effort. And again, we encourage people to go to loveourneighbors.org. I'm so proud of the volunteers who have stepped up to the plate. That's how we're going to get through this difficult time, is by each one of us doing our part to come alongside of each other and get through this COVID-19 pandemic.
Thank you so much. Well, we have run out of time for tonight, so I wanted to thank all of our panelists for being here tonight and contributing to this ongoing community conversation.
We also want to thank you at home for sending in your questions. If we didn't get to your question tonight, we'll continue to answer them in our daily updates throughout the week.
In addition to our Facebook page, you can also find us on YouTube under Stanislaus County Office of Emergency Services, on our website at stanemergency.com, and as well as Instagram and Twitter. Just search for the keyword Stan Emergency.
So thanks again, and we'll see you next Wednesday for another Facebook Live Q&A at 5:30. Good night, everyone.